Assalamu alaikum. I am Dr. Ahmed D. Abdulwahab. I'm a radiologist. First of all, I want to thank you all for your nice comments and your participation in the cases that we published previously, case 1, case 2. And now today we will present the case number 3 of an 8-year-old child, male, presented with abnormal behavior and progressive limb weakness. So MRI was done, brain MRI was done for this child, and we will see the findings together. And as usual, you are required to provide a diagnosis or a differential diagnosis of the case in the comment section. And after 24 hours, tomorrow, we will publish a video discussing the findings and the diagnosis and differential diagnosis. And as always, every day there is a new case and the next day is the answer. I would appreciate if you subscribe to the channel and tell your friends to subscribe, and maybe participate in the comments, any notes, any consideration that we should do in our presentations. I would be very much appreciative of that thing. So this child was imaged under anesthesia, sedation, not anesthesia, and you can see some motion artifact here and there. However, the image quality is quite good. First of all, we can see that there is a lesion, and this is the lesion that we are talking about. This is a flare, coronal flare. That's a T2 weighted with suppression of the CSF signal intensity. As we can see, the CSF in the ventricle is black, and you can see that the gray matter is hyperintense while the white matter is hypointense, indicating that this is a T2 weighted image. However, let's continue. We have a lesion here. This lesion appears to be cystic, and there is a mural nodule here with some surrounding edema, mild edema. It's causing mass effect on the adjacent ventricle, the third ventricle here. Let's see the T2 weighted image. There is some motion artifact, as we said, because it was under light sedation, not heavy sedation. You can see the brain, the cerebral hemispheres basically are normal. There is no migrational anomalies. There is no like schizencephaly or ectopic gray matter or anything like that. You can see here at the site of the right thalamus and at the midbrain and possibly the upper pons, there is this cystic lesion containing a neural nodule here. So let's see on the T1 weighted image what's going on. On the T1 image, you can see that this is the neural nodule and the cystic component here, and it's causing mass effect on these structures. So what is the logical next step? First of all, let's see the sagittal T2 weighted image. You can see this is the CSF is hyperintense, it's white, indicating that this is a T2 weighted image, and you can see the lesion here extending from the area of the thalamus involving the midbrain and part of the upper pons, and you can see it is mainly cystic with a mural nodule. So what should we do next? What is our next step? Of course, it will be to give contrast and see how the lesion will enhance or not, and the pattern of enhancement. First, this is the T1 weighted image post contrast, and you can see that the mural nodule is showing enhancement, possibly the wall also showing enhancement, and nothing else. Let's see the sagittal image of the post contrast. You can see here the mural nodule and the lesion. The wall is showing some mild post contrast enhancement. It's not marked. Another T1 weighted image. You can see here good enhancement of the mural nodule. Okay, and let's see the sagittal T1 weighted image. This is a T1. The CSF is black, the gray matter is dark, and the white matter is bright, indicating it's a T1 weighted image. You can see the contrast in the cerebral venous sinuses, and you can see the nodule is enhancing and the cystic component is not. Now we can see also the diffusion to see whether it is restricted or not. You can see that this is the ADC map showing the cystic component to be not diffusion restricted, and you can see this is the ADC map and also there is no signs of diffusion restriction. So what is required from you is to provide a description and a diagnosis or differential diagnosis for this case. I'm waiting for your answers in the comment section. Please don't hesitate to participate. We need to make this an interactive session, and tomorrow we will provide the answer.